In the shadow of the Rocky Mountains sits the remote community of Field, population 175. The town is so small, the ambulance service was the only health service available.
Field has always been one of those remote stations where staffing is a challenge. One of the parts of the community paramedic program was to try to stabilize some rural staffing.
And that's what has allowed Craig Chapman to be both a community and an ambulance paramedic. The two positions provide him with a steady income that allows him to provide medical services in the community he calls home. For Craig, the community paramedicine program allows him to help others lead healthier lives.
So with blood pressures, it's much more important to pay attention to trends.
On this day, he starts at a walking clinic in Golden.
We did that in conjunction with Interior Health, and it's a walking program that's primarily aimed at seniors. It's just to get people out of their homes and on the trails and focused on moving. Through the winter, we do an indoor walking program, the Recplex, and then we move outdoors in the summer, and generally just want to encourage people to get out there, get moving, and work those joints and muscles.
Key to the success of the program is the ongoing relationships that are developed by being at the clinic, walking with seniors along the riverbank, encouraging them, seeing them in the hospital and at home.
Anytime somebody comes and talks to you about your health and activities and encourages you is beneficial. It's the same relationship as a coach with an exercise class. And genuinely, there are people who are confused about their health conditions. We see people, especially with diabetes, who get confused or don't fully understand their medications and how to use them.
The community paramedicine program started with a focus on seniors' care. The program remains true to that objective, but it's growing in response to the communities it serves. Deep in Yoho National Park sits Emerald Lake Lodge. It's a remote facility with a summertime workforce of more than 150 people, serving thousands of guests.
Realistically, even with the ambulance responding to a 911 call from Field, any response there is going to be 20-25 minutes plus. So one thing we identified with the opioid crisis in BC was a potential situation at Emerald Lake could result in a fatality due to the lack of response. So we went in there and we organized getting them their naloxone kits and gave the management, security staff, the first aiders their training so that they're comfortable injecting.
We all got to use the kits and actually inject them into oranges, but we all got to break the vials and actually use the needles and see how it worked.
Back in Field, Craig is working with the Recreation Advisory Committee. Together, they're repurposing this church, turning it into a wellness center. It's a part of an expanding mandate that preserves the essence of a community by filling a gap in the delivery of healthcare to remote communities.
We are definitely aging in place, and we want to stay here. We want to be active and enjoy what this environment offers. And having Craig here means that we don't have to hop right in the vehicle and drive to Golden. We can call Craig, we can have a quick consult, he can give us guidance on what he feels the best course for us is and just give us some really good advice.